I'm going to talk about some normal and common vaccine side effects that I see in children when they get their regular vaccines. So we give vaccines routinely at 2, 4, and 6 months that are typically killed vaccines. And sometimes with those shots, we'll see a swelling in their leg where the shot was given or the shots were given. Sometimes their leg will get red and raised. Sometimes even the whole thigh will swell up. And that's still considered a normal local reaction, but a large local reaction. Every once in a while, kids at that age will get low-grade fevers, but I don't see it very often with those shots. At a year, between 1 and 1.5, we do give some live vaccines. So the MMR and the chickenpox vaccines, they do tend to cause fever. Sometimes with that chickenpox vaccine, they'll get a little bit of chickenpox spots, usually pretty light ones, but those are considered contagious if they do get that. So if that happens to your child, you want to keep them away from children who are less than a year or pregnant mommies. And then the other vaccines that we give at a year are typically the boosters, which sometimes will cause redness and swelling like the infant vaccines will, and sometimes no reactions at all. The hepatitis A vaccine doesn't really have any documented side effects other than muscle soreness. Then at age 4, we give 2 boosters. One of them is the MMR chickenpox combo, and that one can cause fevers again and can also sometimes cause that chickenpox rash. The other one is the DTaP polio booster, and the DTaP in that sometimes causes that large local reaction in their arm where they get red and swollen and raised. And again, sometimes no reactions with those. Then at age 10, we give 11 now, we give 3 vaccines. There's the HPV vaccine, the meningococcal or meningitis vaccine, and the Tdap vaccine. And with those, the most common reactions are muscle soreness. Sometimes kids will faint, I think because they're a little older, and also middle school and high school kids tend to be dehydrated more, so they're more prone to fainting after their vaccines. They usually don't get fevers after this, and they often do have muscle soreness. So yeah, those are most common side effects with our routine vaccines.